Good morning or good afternoon, depending upon where you're joining us from around the world. I'm Lonnie Summers with the Fetal Health Foundation. I'm the founder of the organization, and we're very excited to have you joining us today for our fetal care chat. We're going to be talking about TAPS, which is a form of twin-to-twin transfusion syndrome. It's a very important one to talk about because probably recently in the last 5 to 7 years is something that our medical community has known about, but is really taking on new ways of discovering and finding out about it during a pregnancy, a monochondrial pregnancy, which is where identical twins share a placenta. I'm joined today by Stephanie Ernst, who is the founder of the TAPS Support Foundation with our wonderful neighbors across the pond over in the Netherlands. And I'm also joined today by two esteemed, wonderful doctors that have worked very heavily in the TAPS area. That is Dr. Femke Slaghekke, as hopefully close as possible there, and then Dr. Enrico Lopriore, who will be joining us and talking a little bit about that. But for those who don't know much about the Fetal Health Foundation, a quick background: Fetal Health Foundation was started back in 2004, actually as an event to bring awareness around actually twin-to-twin transfusion syndrome at the time. And quickly we realized that there was no organization that dealt with all fetal anomalies and syndromes that can take place. So one of the things that we wanted to do was create a foundation that addressed that advocacy, research, and so forth. And we're very fortunate now, coming forward almost 15, 16 years later, that we have some amazing programs such as our fetal therapy think tank that is working on different things of innovation and certification, all kinds of things to improve outcomes. So it's been a very, very interesting time frame. We are fully patient-driven organization, and it's been wonderful to work with amazing groups such as Stephanie and others throughout the years as we try to offer support for families when they go through a fetal diagnosis. It definitely changes everything for them when they walk into an office thinking they're just getting a routine visit and find out that they need to be potentially fighting for the lives of their unborn child or children in the case of a multiple pregnancy. Also joined by Talitha McGinnis, who is our Executive Director of the Fetal Health Foundation. And she's going to be there for you to do any chatting with, any questions that you might have. She'll be monitoring that and bringing those questions you have through there. Very happy now to start out. We're going to turn things over. And Stephanie, we want to talk to you first. And tell us a little about your personal journey with TAPS.
Yeah, well, basically my journey starts back in 2013, where I found out that I was pregnant with identical twins, and huge surprise to all of us. I mean, there is I'm still pretty sure that their local hospital tells the legend of the Australian lady who jumped off the couch and told them that they were lying when they told her she had twins, was having twins. But I actually had a fairly uncomplicated pregnancy up to about 24 weeks. And looking back, it's always interesting to say, and knowing what I know now, it's always interesting to kind of look back and go, well, okay, I was having backaches and my belly was feeling tight and everything like that. And I went in at my 24-week appointment and they said, oh, look, there's a fluid imbalance in your twins and one is really stuck and the other one has got too much fluid. We think you have twin-to-twin transfusion syndrome. And so what they did was they were calling around, and the normal protocol where I live is to send everything to Amsterdam. But my gynecologist at the time said, you know something, I'm going to bypass the protocol and I'm going to send you to Leiden, which is about an hour and a half away from where I live. So we jumped in the car, we drove to Leiden, and they told me I had twin-to-twin transfusion syndrome. And there was also this other thing that was happening, and they were just looking at it, and it really wasn't doing much, but they thought that maybe I might have TAPS. But it wasn't on the radar for a little bit, but the PTS actually stabilized, but the TAPS got worse. And so at 31 weeks, I actually went in for a routine appointment, and I didn't go home for another week. So that was pretty much it. And it was a really hard time because at that point in time, there really wasn't a lot of information out there about TAPS itself. I had access to one website in Dutch, and my Dutch was not great then. It's really not great now, but and there was also a Wikipedia page, and that was really all there was. So for me, it was a very challenging time. Yeah, finding out that you have this disease that no one can tell you anything about is kind of quite tough.
And how did you feel? First, you were diagnosed with potentially twin-to-twin transfusion syndrome, and I'm sure, like everyone else does, you go and look up what that is on the internet.
Yeah, exactly.
And they mentioned something about TAPS. What were your feelings and what were you thinking during that time frame from going from twin-to-twin transfusion syndrome to now something called TAPS?
It was already very confusing and quite confronting because you're presented with all the worst case scenarios and the best case scenarios. And added into that, I was 16,000 kilometers away from my home in Australia and family. And I really only had my husband and my kids here. Sorry, my husband and my in-laws here. So having a support network was really, there was no support network outside of direct family. We have friends, of course, but yeah, it was really quite confusing, quite scary, confronting, because you have to make decisions that may not necessarily, split-second decisions that are quite tough to make.
Absolutely, and obviously, one of the things that has definitely changed for us as a foundation is when we first started this, it was misinformation on the internet. Now there's the wonderful world of social media, which has been a wonderful tool for people to be able to get together and share and support each other. However, it's exponentially confounded the challenges of misinformation out there. What was your experience? Because I know you're pretty active on social media, and that's kind of how you got your start, which is going to lead us into talking a bit more here about your foundation too. But what was your experience going through that particular part when you're looking for information, looking for support?
Well, outside of the two websites that I talked about, there was really not anywhere that I could turn to talk to anyone about that outside of course, the doctors I was seeing. And, when I was trying to talk to friends and family, they had no clue what I was talking about. It was hard enough to find someone to talk about transfusion syndrome. So yeah, it was quite difficult in those circumstances to actually find anything other than medical journals, which, a layperson really doesn't know how to read. So that was probably the biggest challenge as well, just finding good quality information that was easy to read and that, wasn't out of date or old as well.
And so then tell us, because we've talked about the story a little bit. So now your children.
Yes. Emily and Matilda, they will be 7 in 3 weeks' time. Yes, wow. 12th of December, they will be 7. And they're doing incredibly well. They're very healthy. Physically, they're very healthy. We are currently going through some testing. Of course, with TAPS, there are some long-term effects. And getting to the point where I can actually have them tested has been challenging in itself. Mainly because there is a lack of information out there for people to look at. And, I sometimes will walk into appointments and I'll take a stack of papers and I'll say, hi, Emily and Matilda had TAPS. Here's a stack of papers for you to read. This is your crash course. At the time. But for the meantime, I can tell you a little bit about it. And it's usually, I've had doctors run away screaming and saying, we don't want to touch this. And others saying, but it's just PTTS, it's okay, they're out now, it's okay. And, but yeah, getting to the point where I can have them tested. And we recently found out that Emily has been heavily affected, as donors do. We recently found out she has something called a developmental coordination disorder, and we are having more testing done at the moment. But all in all, happy, healthy 7-year-olds who love princesses and Kadri, which is a musical group here. And yeah, they like to roller skate and ride their bikes. Really good, really great kids, and I'm so blessed to have them.
Well, when you go through something like this, it's pretty easy to, and anybody, no one would blame that when you go through a very traumatic situation like this, You obviously were very fortunate to have a successful outcome. Obviously still dealing with some challenges, but overall they're beautiful, healthy girls. It's very easy to, life is busy and we all want to be able to give back and help out. But you decided to take a different turn. Yeah, I know you started out being very active and learning as much as you can about TAPS, and providing support to those that could be going through that, especially with, exactly, I think the medical community's first thing is they look at this because sometimes the medical community knowing what twin-to-twin transfusion syndrome is, sometimes we're lucky in that getting diagnosed properly, let alone TAPS. So what was your motivation for, starting out and supporting families going through this with information and your own personal experience?
Sure. I guess one of the things is that when I was going through all the Facebook groups, because all of a sudden when everyone found out I had twins, I was added to every single Facebook group out there. And I started going through and looking at people's posts, and they were talking about having things like mild TAPS, or that they had this, their doctors didn't know why their babies were born red and white. And I realized that there was a lot of misinformation out there. And then not only that, I started realizing that, hey, I'm not alone. I wasn't alone in my diagnosis. I was quite thinking. So there was more people out there who were kind of looking for someone else to relate to. And then when I kind of started having this idea around my girl's 5th birthday of I should do something and give some money back or do something. So I started thinking about, maybe I should have a fundraiser for the girl's birthday. And I actually discussed it with Dr. Lopriore. I don't know if he remembers, but I discussed it. And then I said, and it took a couple of years of research to actually realize that, just raising money can lead to lots of tax issues. And also people are kind of less supportive of just giving people money randomly. So I thought, well, what can I do? And around the same time, I went, you know what, let's see if I can get all these TAPS families into one place. So I started a Facebook group, and then my brain started going, you know what, I've got a group. I want to raise some money. I want to give back because I have this great connection and I have this thing. Maybe I should look at doing a foundation and starting and really working on doing something with the information I had, the access I had, and also the ideas that I had. And that's really where the foundation started, was just wanting to support research and support families.
Which is tremendous, which takes a lot of work, and we commend you on that. I know it was a lot of work getting there because there's a little bit, a lot of work, and I know when you launched it, it was a big triumphant day, so congratulations on that.
Yeah, and also the day that I launched it, I was actually at the LOMC having long-term testing done on one of my daughters. So I was watching all the Facebook social media on my phone whilst my children was in having her hearing tested. So it was quite a full day. Trying to balance everything.
Yeah, definitely, which tends to be a common theme regardless, with children regardless throughout life.
Absolutely. Absolutely, yeah.
Probably a question before we jump to our esteemed doctors here for you is with the foundation and your mission of supporting families and so forth, what advice do you have to families who might be diagnosed with any type of fetal syndrome?
That's a really good question. And I think it really comes down to, there's a number of things that, first of all, you're going to come across a lot of challenges, and your brain is going to be overwhelmed with so much information, and really just take the time to think through things and process the information. The second thing that is really important is that you're not alone. The diagnosis you have, you're not alone at all. Look out for groups, support networks and things like that. I mean, we're not the only Facebook support group. We're very specialized in TAPS, but connect with other people, talk with them about their stories, and really try and take that information on. But I think really also ask questions. Don't accept the final answer, and talk to people, talk actively to people, get the information. And I think what's really important to know is that there are guidelines in place that doctors follow, and sometimes they do follow them quite rigidly. And it's really okay to ask questions and get a second opinion. And I think one of the most important things I learned was that a very wise doctor said to me once that as patients, we really do need to remind doctors sometimes that they don't know all the answers. Challenge them with a little bit of out-of-the-box thinking. Guidelines are really just a framework for the minimum standard of legal care. It's not the absolute final rules. And another thing to doctors I think is really important is that don't tell patients to not go out there and Google, because that's like telling Emily and Matilda to not eat cookies before dinner. Patients are going to do this. And so it's better to open a conversation with them, because when they get the diagnosis, they're processing a lot of information. Let them take it in. They're going to hear the worst case scenario. And I can tell you that from personal experience. They really will listen to they will hear. The only thing they will hear is the worst thing, the worst possible scenario. Let them go away, take the information, process it, and then check in a couple of days or at the next appointment about what's going on. Did you understand everything? Have you got questions for me? Tell them to write things down. And that's really another important thing. But don't dismiss the concerns, and don't tell them not to Google, because that's, they're going to go and do it. And not all mom groups on Facebook are the same. So that's the other thing.
Yeah, no, you're absolutely right. I'd say that misinformation is challenging, and it's really easy when someone's gone through this as a parent has gone through this. You've had your own personal journey. It can be very easy at times to take your experience and think that everyone's having that same experience and they're saying that path. And this is a medical condition, and nothing is textbook. Everything can present, everything can look differently, and so forth. And that's what we have the experts there. So like Stephanie said, you did it so perfectly, and that is one, don't, ask questions. Don't be afraid to do your research. You need to be the strongest advocate for your pregnancy and your babies. But also, realize that it's okay to ask. It's okay to get second opinions. It's okay to ask, and it's certainly okay to seek support. And in that support, make sure that also you sometimes take the support is there, but make sure you take information with a grain of salt. And and saying that, meaning that medical factual information is so important. Speak with the experts. Speak with foundations that are trustworthy, that are credible, that can get you and lead you to the right information, because the worst thing in the world is misinformation. And it still exists there today. I know, Talitha and I going, she with her twins went through twin to twin. I did with my twins. And at the time, I think we were only a couple of years difference in our experiences, but at the time it was everything from just drink more protein to cure it, to have majorly invasive surgery that could put the mom's life at risk. And it was really hard to figure out what was real and what was true and what was factual. And especially in today's age, anything can seem very credible and credit worthy, because we very easily, we've been conditioned that anything posted on social media doesn't have to look flashy, but it can sound creditable. And it's not always the case. So just do your research. That's the biggest thing that we can tell you, and know that you're not alone. And it's okay to talk to people. One of the things that the Fetal Health Foundation, and I know the same thing is with Stephanie and support, and the support piece is so important. It's a roller coaster. Being a male, I can tell you that we tend to deal with the diagnosis differently than our wives do. And that can cause challenges in relationships. It can cause challenges in how everyone deals with that. Don't be afraid to reach out and talk to people. I've told people before, you can call me and we can talk about, we don't even necessarily have to talk about the diagnosis. I've got all kinds of terrible dad jokes to tell you. And things like that, but anything to help take your mind off of things, or help know that you're not alone, that it is an emotional roller coaster ride. I mean, you can be watching a commercial about laundry detergent and break down for no reason whatsoever. So we understand that going through a very stressful time. So Stephanie, thank you so much for sharing your story, and certainly it's the amazing work that you're doing with the TAP Support Foundation. This is what's wonderful in the age of technology and stuff, is it doesn't matter where with Fetal Health being in the United States, located out of the United States, you being located in the Netherlands, it doesn't matter. We're worldwide there to support families going through this anywhere. So that's amazing. So we commend you on that. So now I am very excited as I try my best to make sure I do not butcher names here, to introduce you to our medical experts to talk to you more about what TAPS is, what treatment options are available, and so forth. And I know they are wonderful because they prepared even a PowerPoint to go through things, which makes my job a little bit easier. I don't have to ask a whole bunch of questions since they've got it all prepared. So I am going to turn this introduce now and bring up our wonderful esteemed doctors. I have Dr. Femke Slaghekke, or pretty close to that, and
yes.
then Enrico Lopriore, which that just, it does roll off the tongue. It does sound very romantic. So as I said, we have both sides of languages here. So with that, welcome doctors. Thank you so much for joining us, and we're ready to learn more about TAPS.
Thank you for the kind introduction, and thank you for the opportunity to share our thoughts about TAPS, because we think it's very important to learn more people what TAPS is and what the difference is. And like Stephanie said, it's very important to get the right information out there. Lonnie, could you please make sure I can share my screen? I think I'm not able to do at the moment.
Okay, let's see. All right, this is why we have always fun with technical challenges, but what I am going to do, let's see. Nope, didn't want to do that. Did that work?
Let me try. No, not yet.
Okay, so I'm going to make you host. That should allow you to hopefully share. And then after that, after your presentation, I might need you to remake me host. But
yes, I'll do.
There we go. Okay, now hopefully.
Yes, now I can. Share. Do you see my screen?
We can see it. That's wonderful.
Oh, and this is not what I wanted to do, because I did not want to start at the top. And sometimes you see the, and do you see the slideshow, or do you see also the next slide?
We see your slideshow and the next slide.
There we go. Now you see the.
Yep.
Now you see only the slideshow and not the next slide, correct?
Correct.
Good. So thank you for your introduction. So my name is Femke Slaghekke. That's how you pronounce it in Dutch, but I think you did a very good job. I'm a maternal fetal medicine specialist at the University of Leiden, and also a fetal therapist. I know in America it's different. You have pediatric surgeons that are fetal surgeons, but in the Netherlands we're all maternal fetal medicine specialists. And next to me, that's Enrico Lopriore, and he is our professor of neonatology. And so we will combine this presentation, and we will talk about TAPS today. And now, yeah, so what we will do, we'll do a little bit, this will be the outline of this PowerPoint. So we'll first do a little bit on the pathogenesis. We'll talk something about the antenatal diagnosis, the postnatal diagnosis, the treatment options antenatally that we have, and then something about the short term for neonates and the long term outcome for these children. I'd like to start with the pathophysiology. So this is a complication in monochorionic twins, and there's a disbalance between the two children. So they share their placenta and they share their blood circulation, and there can be a disbalance. And if there's a disbalance through large anastomosis, you can develop TCTS with the oligohydramnios and the polyhydramnios sequence. And if you have a transfusion through tiny, small anastomosis, you can develop twin anemia polycythemia sequence. So they both are due to transfusion from one twin to the other, but the difference is in TTTS you do have the big difference in amniotic fluid, and with TAPS there's one anemic twin and one polycythemic twin without such a large difference in amniotic fluid. It can occur spontaneously, so just because on the placenta there's some tiny anastomosis, or it can occur after laser treatment for TTTS. So if the laser treatment for TTTS, if there were some tiny anastomosis still there, then you can also develop TAPS. So what is TAPS actually? So you see a very tiny anastomosis on the placenta, and there's a transfusion from one to the other, and that will result in one anemic twin. On the left you see a very pale anemic twin, and on the right side a plethoric polycythemic twin. And the cause is in the placenta. And I hope that everybody is scared by this picture. We love them. Professor Lopriore and I, we inject a lot of placentas. And we looked, and that's what we do. And that's how we learned, and that's how we found this condition as well, by looking at a lot of placentas. And as you can see on this placenta, on the left side pink and on the right side yellow, that are the veins. And blue and green, that are the arteries. And if you look very quickly, it almost looks like a placenta that has been lasered. You don't see that many big vessels, but if you look in this detail, you see a very tiny anastomosis. And then on the right side, you see the artery, and on the left side, the pink vein. And that means the transfusion was from the right side to the left side, from the artery to the vein. And this was causing twin anemia polycythemia. Here we see another placenta. This is a placenta, there was a case that had twin-twin transfusion syndrome. And what we see here is the laser line. You see the different dots where this was where big anastomoses were lasered. But between those laser dots, there was a tiny vessel that was there, which caused a twin anemia polycythemia sequence. So this one is another direction, so from left to right. So how often does TAPS occur spontaneously? And we say it's 3 up to 5% of the cases of all monochorionic twins. And what's the incidence of post-laser TAPS? So of 100 monochorionic twins, there will be more or less 10 patients developing twin-twin transfusion syndrome. And of those cases, there will be 2 to 16% post-laser cases. Previously, we had more towards the 16%, but with developing a new technique for twin-twin transfusion syndrome, which is the Soloman technique, we saw a reduction in post-laser TAPS, and now we see it much more frequent. Then I would like to continue with the antenatal diagnosis. So how do we find TAPS antenatally? We look at the MCA-PSV difference. So in an anemic twin, the MCA-PSV will be very high, and it has to do with the blood is very thin. There are not that many red blood cells, and that the blood flow will be very high. And if you measure the middle cerebral artery, the peak systolic velocity will be high. In the co-twin, which is polycythemic, it has a lot of red blood cells, the velocity will be low. And it's the difference between the children that makes it a TAPS. And you can plot those findings in a chart, and here we see a chart. And in the beginning, we see normal Doppler measurements, and then you see in one twin, it's increasing, and the other one, it's declining, and then you see there's a big difference in the MCA-PSV measurements. Previously, we used the cutoff levels with a high and with a lower MCA-PSV level. But we also find cases where there was a difference in MCA-PSV. So for example, here it was above the 1.5 and below the 1.0. But what we found was there were still neonates born with an anemia and polycythemia, but that didn't meet the previous criteria. So sometimes there's a donor above the 1.5, but the recipient not low, or the other way around, that the donor was not that high, but the recipient was quite low. And then we did another research project, and we found that by doing a delta MCA-PSV, we saw it's a better prediction for twin anemia polycythemia. So there are some additional findings on the ultrasound. So that's also important for patients that are with us today. So you can ask your doctor to look for additional signs of twin anemia polycythemia. In the recipient twin, in the liver, we can see a starry sky, and we call it starry sky because the liver itself becomes a bit more darker and the vessels in the liver become more bright, like stars on the sky. That's why we call it the starry sky liver. And with the anemic twin can develop cardiomegaly due to the anemia, which means that the heart size is enlarged. Or you can see a dichotomy placenta, which means there's a color difference in the placenta, and then the darker part belongs to the recipient and the brighter part to the donor. And in this image, you see that the size of the thickness of the placenta is the same, but what we see sometimes in TAPS is that also the placenta share of the donor is not only bright, but also enlarged and thick hydropic because of anemia. Now I'd like to continue with the postnatal diagnosis. And I would like to give the word to Enrico because, well, he's our neonatologist.
Hi, everyone. So I'll continue with the postnatal period. And not always these twins are diagnosed before birth. Sometimes we are surprised as neonatologists because we come to the resuscitation room where the babies are born and we see a red and a white baby. And sometimes it was diagnosed before birth and then it's not a surprise to see these twins with a different color. What we see it's not only the color difference, but this color difference is of course due to a difference in hemoglobin values. And the donor has anemia with a low hemoglobin value, and the recipient has polycythemia, so with very high hemoglobin values. And what is very important is to look forward and not only stop at the hemoglobin values, but measure the reticulocyte count. A reticulocyte is a very young red blood cell. And when you are anemic, when you don't have enough hemoglobin, your body will start producing a lot of red blood cells, and these are called reticulocytes. They are young red blood cells. So when you're anemic and for a long time, your body will produce a lot of reticulocytes. And this is what we see in TAPS. The reticulocytes are very high in the baby that is anemic, and they are low or normal in the baby that is polycythemic. That is typical. Another thing that you can do, these are the classifications. So we need to define TAPS, we need to have a high hemoglobin difference because sometimes this baby have a little difference, but then we don't call it TAPS. It's only when it's bigger than 8 grams. And then we need to have this discordance in reticulocyte count between the donor and the recipient. And we also always advise to look at the placenta. And as Femke showed you, we like to inject the placenta, but most people don't do that. That's it's quite challenging. So, and it takes time, but it teaches you a lot. If you don't have time to inject the placenta, you can always turn around the placenta. And what you then see is the same color discordance as you see in the babies. These are examples of babies with TAPS. Actually, some of them are known to one of our, to Stephanie. But these placentas of these TAPS babies have a different color. You see the dark one here on the right side is from the one with the polycythemia. So if you don't have the chance to inject the placenta, then just turn around, flip around the placenta, and you will see this typical color difference. And then we'll go back to the treatment, and the treatment is mainly antenatally. So Femke will tell you more about that.
So there are different treatment options, and I would like to discuss all the options that we always explain and discuss with parents. Of course, there are expectant management, which means that we have to closely monitor these pregnancies, and we keep on watching them with ultrasound to see whether the anemia and polycythemia is progressive, or whether it's signs of deterioration, whether there's signs of fetal distress. If there are signs of fetal distress, we can decide to do a preterm delivery after a dose of corticosteroids for lung maturation. And another intrauterine treatment that we could do is intrauterine transfusion, with or without a partial exchange transfusion. That means that we give transfusion to the anemic donor. So what we do ultrasound guided. We are looking, we're going with a needle into the in the umbilical cord, into the vein, and we measure the hemoglobin level of that twin, and then we calculate how much blood we need to give. But that's not causing the problem, that's not treating the cause. So what will happen if we give a transfusion to the anemic twin through the anastomosis on the placenta, that blood will also go to the already polycythemic twin. So that's why we also, in some cases, advise to do a partial exchange transfusion. So what we do, we take some blood out and we give some saline back, just to dilute the circulation of the polycythemic twin. Another treatment option is laser treatment. So that's fetoscopic laser treatment, as it is suggested for twin-twin transfusion syndrome. It's different than as in TTTS, because in the beginning, TTTS, you have oligohydramnios and polyhydramnios, and you have a tensed uterus where you have more easier access to put in your fetoscope. With TAPS, both have more or less normal amount of amniotic fluid. And there are two challenges. One is entering your fetoscope. So actually in all those cases, we need to infuse saline first, so to make a polyhydramnios. And then in a lot of cases, we also need to drain the amniotic fluid in the co-twin. As you can see in this picture, in this image here, this thin line you see, that's the equator, the membranous equator. So that's where the both sacs separate. If you enter the uterus, it's hard to see the vessels on the other side of the membrane. If that child is stuck, like in TTS, then the membrane will be flat on the placenta, and then you can look through and make sure you can find all those vessels. So that's why it's a bit more challenging to do a laser treatment in twin anemia polycythemia sequence. And if you do a laser, we advise to do the Soloman technique. What's the Soloman technique? With the Soloman technique, after identifying all the individual anastomoses, we connect the dots from one placenta margin to the other. So you draw a whole line so that also really tiny anastomoses that you might not see are also coagulated. And here we see a placenta treated with the Soloman technique. So again, green and blue for the arteries and pink and yellow for the veins. And you see a complete laser line here in the middle of the placenta. So these twins, the circulations were separated. And I do not want to comment very long on this one, which we call selective reduction. We sometimes offer it to patients in case of severe sick, if the one twin is severely sick or damaged or congenital abnormalities. But it's also always in discussion with parents if that would be an option for them or not. And then Enrico will talk a bit about the outcomes for the neonates.
Try to be maybe a bit more quick. What is important to know is that these TAPS twins have an increased risk of mortality. And it's around 9% in spontaneous TAP, and it's higher in the post-laser TAPs because this baby had twin-twin transfusion syndrome, of course, before that. And it's higher in the donor compared to the recipient. And the other thing that is important, not only they have an increased risk of mortality, so of death, but they have also an increased risk of neonatal morbidity. And it's around 33 to 40% of complications during the neonatal period. And it's partly due to the fact that some of these are born prematurely, around 32 weeks on average. and 4 to 11% have severe cerebral injury. So it's important to have a ultrasound performed at birth if you have twins with TAPS. And the most important thing, we think, is to look at the long-term outcome. We didn't know what was the outcome in these TAPS twins because we didn't have any data on that. So we performed a study, a long-term outcome study, and we found out that the outcome was not as good as we hoped for. And what we saw is that what we do when we talk about long-term outcome is we measure the mental development, but we also look if the babies are hearing well, and what about their eyesight and their motor development. And what we saw was that in the post-laser TAP, so that's the twins that have twin-twin transfusion syndrome and then developed TAPS, we had, well, more or less 10% had impairments, but it was the same or actually a little bit higher in the recipient. But in the spontaneous TAPS, so in the monochorionic twins that spontaneously developed TAPS, to our surprise, the risk of impairment was much higher in the donor compared to the recipient. 18% of the donors had impairment. And this was partly due to a cognitive impairment, so these children had difficulties at school, but also due to hearing problems. 15%, so 1 in 8 of these babies had bilateral deafness. And that's very important to know, because if you know about this, you can, well, test the hearing of the babies at birth. It's a screening tool. And if you find out that the babies have deafness, you can, well, prevent hearing delay, because if the babies are helped soon after birth with the babies with the hearing problem, you can, with all kinds of tools, you can help them to develop speech more easily. That's the screening tool that we have, and also probably in America. So I guess that's, in view of time, the most important things that we wanted to tell you about. It's a disease, so it's new. It's a new disease. That's most important. So most of the gynecologists probably in the world may not know about this disease, but it is there, and it's due to this very tiny anastomosis. There is a way to diagnose it if your gynecologist is looking at these Dopplers ultrasound. He will be able, or she, to find out if there is TAPS or not. But often, also in the Netherlands, it's not always done, these Doppler measurements. So we certainly would advise to do that. Otherwise, you will not know the babies have TAPS until birth. And at birth, you will see this red and white baby. And then it's important to measure the hemoglobin and reticulocyte count. And if you have the possibility, to inject the placenta. We don't know what the best treatment is. We are doing, though, a randomized trial which is running at the moment, but it will take a couple of years before we know what the outcome, what the best treatment is. Until then, it's good to be aware that these babies are high-risk babies. So we have to take this disease seriously and be aware that they have short and long-term outcome problems. And one of the most important things that I would like parents to know is that they have this risk of deafness, and you can do something about that by detecting it as soon as possible. Thank you for your attention. I hope it was clear for you.
That was incredible. Thank you very much, and you guys did a phenomenal job too of making it very understandable by those that might not have the medical knowledge background on this. We actually have a couple of questions coming in. Actually, first question I have about this is, and actually might flow into a little bit of the question that we also received here, is with TAPS being something fairly new that we're now looking for. How often would you recommend, because it looks like through the charts that you were showing is, it may not show for some time in the pregnancy, and it could vary too. How often should those MCA Dopplers be performed?
We advise to do it every 2 weeks. So it's the same for all monochorionic twins. Make sure that from at least 16 weeks onwards, have your scan at least every 2 weeks. And if you have your appointment, make sure that they also do the MCA-PSV measurement. So every 2 weeks. And if you see an abnormality, then your doctor can maybe see you more often, depending on the findings that you have. But at least every 2 weeks.
Great. And actually the question we brought in kind of flows into that is someone says, if I'm pregnant with monochorionic twins, what tests do you recommend in monitoring for TAPS? And I guess really maybe expand that about it. If you're pregnant with monochorionic twins, what should you be looking for, period? Because obviously there is SIUGR, TTS, and TAPS that you need to be paying attention to.
Yeah, so regarding all these 3 questions and all the complications that you can have at monochorionic twins, it's very important that you have your ultrasound scan at least every 2 weeks, and then you need to monitor for the growth to see for the SIUGR. You need to monitor the amniotic fluid, the amount of amniotic fluid, and look for bladder filling and stomach filling to see whether there are signs for TTS, and also look at the MCA-PSV to see whether there are signs for twin anemia polycythemia.
Right. And for those that may not understand, SIUGR is selective intrauterine growth restriction, and essentially it deals with placental share. So the monochorionic twins obviously present itself some unique challenges in shared osmoses that can be causing challenges from TAPS or TTS, but also a placental share where I like to probably, this is very lay term, way to describe it, but I kind of just tell people it's like having a loaf of bread as the placenta, and one baby's got a very small, tiny portion of it, the other has a majority of it, and the one that isn't getting enough of the portion of the placenta can have challenges in their growth, which can lead to that baby being very sick. And it's so important, as I'm sure that you guys would agree too, is that if you have any findings, make sure you talk to your doctors, make sure that they're also comfortable in reaching out to the experts and they get you that care, even if it's just a consult, because these conditions are rare, but they're numerous enough, and there's enough complications. And most of the time, a twin pregnancy goes completely fine, but it does put you in a high-risk situation, and you need to be obviously paying attention to those things. And so that if something does start showing itself, early treatment, intervention can be done to ensure that you have a successful outcome at the end of the pregnancy, and you get to take home your 2 wonderful baby boys or baby girls. Taitha, do we have any other further questions? Other questions? Great. Well, thank you so much. That was so very informative. That really, I learned a lot of new things as well. So thank you so much for that wonderful presentation. Thank you to Stephanie and for all of her work. You can find out more about her by, you can Google, we all know how to do that pretty well. You can Google the TAP Support Foundation if you're already not connected, and obviously the Fetal Health Foundation. We're coming up on a time of holidays. We're also dealing with a worldwide pandemic. It has been a very trying thing. And I know from the TAP support group to the Fetal Health Foundation, we certainly appreciate all the support that people give us, just because the world's going through a pandemic. People are still pregnant, people are still having babies, and people unfortunately are still having complications in pregnancy, which makes it even more challenging when you're dealing with a pandemic on top of that. So any type of support, we certainly appreciate that, and we're bringing it up because in the United States, we have something called Giving Tuesday, which is on December 8th, correct, Taitha? December 1st, got it, okay, December 1st. December 1st is USA's Giving Tuesday, and certainly you can find out more information by going to the Fetal Health Foundation or on our website, but you can do fundraising yourself. You can make a donation, and again, any amount helps tremendously. We work with very little, and that is something I have to commend our wonderful doctors here today too, because the amount of work and care that you guys take into finding treatment options, and I know that you do it a lot of times on a shoestring budget. We know with not to take any away things from cancer, but sometimes getting a couple $1 million doesn't even turn on a light bulb for some of the cancer protocol treatments. And you guys are doing this pretty much on very little funding at times, and it's amazing what you have been able to do. So thank you very much for your continued work. The one thing I want to leave everybody with too is that sometimes it can be very intimidating when you're advocating for yourself, because you're starting out with your obstetrician, and then if they know that you might be in high risk, you might be seeing a perinatologist, you might be seeing a maternal fetal medicine specialist. At least in the United States, we sometimes see as you start moving up into specialties, sometimes the bedside manners of the doctors get a little more intimidating. And then all of a sudden you might have to see our wonderful esteemed doctors here, and you might be even more nervous and scared because of all the work they've done. And I can tell you, out of all that I have ever met, they are some of the most caring, compassionate, and they stay up tirelessly, as I'm sure that both of you have when you have a difficult, challenging case, trying to innovate and come up with ways to ultimately at the end give people their dream, which is that of having a family. So with that, we wish everybody wonderful, happy and wonderful holidays. We thank you so much for being part of our fetal chat. And until next time, please stay safe and take care of each other.